Tonight's presentation C title is Mental Health and Aging, Addressing a Growing Concern from the Archuleta Chronicle. Main themes: seasonal impact on seniors. Winter months can intensify feelings of depression and anxiety, especially due to shorter days, cooler weather, and holiday related stress or grief. Mental health and aging. Mental health issues are common but often overlooked in older adults. These are not the normal parts of aging. They're treatable conditions. Alarming statistics. Suicide rates among those aged 80 to 84 are more than double the general population. One in four older adults will experience a mental health issue, with numbers expected to double by 2030. Common challenges: depression and anxiety. These are the most prevalent mental health conditions in seniors. Contributing factors: uh, bereavement, chronic illness, caregiving stress. Recommendations: awareness and support. Mental health should be a year-round priority, not just during the winter. Community engagement. Organizations like OCAMAC at the University of Florida offer tips and resources to support senior mental health. If you'd like, I can help you adapt these insights into a culturally responsive framework or toolkit for senior engagement, especially relevant to your work on aging and cognitive health. Great question, especially given your myth busting superpowers and commitment to equity driven aging frameworks. Here are some of the most persistent misconceptions about senior mental health, along with clarifications that might fuel your next toolkit or outreach strategy. Common misconceptions about mental health in older adults. Depression is normal. Depression is a normal part of aging. Aging doesn't inherently cause depression. While older adults may face loss of health challenges, depression is a treatable condition, not an inevitable one. Cognitive decline is unavoidable. Mild cognitive changes may occur, but significant decline isn't guaranteed. Many seniors maintain sharp mental acuity, through social engagement, learning, and healthy habits. Older adults don't experience anxiety. Anxiety, anxiety is common but often underdiagnosed in seniors, especially when symptoms are mistaken for physical illness or age-related changes. Seniors can't benefit from therapy. Older adults respond well to psychotherapy. Give me 1 second, guys. I'll get the rest of that for you. Especially when it's tailored to their life stage and culture contexts. Cognitive behavior therapy and other modalities are effective. Mental health issues are less serious in seniors. Untreated mental health conditions can worsen physical health, increase isolation, and elevate suicide risks, especially in men over 80. Seniors don't need as much sleep. Sleep needs remain consistent across adulthood. Poor sleep in adulthood in older adults can exacerbate mental health issues and increase the risk for cognitive decline. Okay, guys, give me a second. They're too old to learn new things. Lifelong learning boosts mental health and cognitive resilience. Seniors can and do learn new skills, start creative projects, and adapt to new technologies. If you're building a resource or campaign, I'd be happy to help you co-design a myth-busting module or culturally responsive messaging guide. Want to tailor this for rural aging communities or caregiver networks next? You're asking the right question, because busting myths is only half of the battle. The real power lies in shifting mindsets and systems. Here's a multi-layered approach to effectively addressing misconceptions about senior mental health, tailored to your participatory, equity-driven style. Community-centered education. Give me 1 second, folks. Okay, host integrational workshops that normalize mental health conversations across age groups. Use storytelling and lived experiences from older adults to challenge stereotypes and foster empathy. Translate materials into culturally relevant formats. Think visual guides or oral histories or multilingual infographics. Infographics. Train providers in age exclusive or inclusive mental health. Integrate geriatric mental health modules into medical and social work criteria. Offer CME credits for training on ageism, misdiagnosis, and culturally responsive care. Use case studies that highlight how depression and anxiety or trauma may present differently in older adults. Public awareness campaigns leverage media and social platforms to reframe aging as a dynamic life stage, not a decline. Feature older adults as advocates and experts in mental wellness. Bust myths with data, e.g., 1 in 4 adults will experience a mental health issue by 2030. Peer led support models. Train older adults as peer navigators or mental health ambassadors. Create safe spaces for sharing experiences, virtual circles, community cafes, or storytelling salons. Normalize help seeking by showcasing diverse role models who've benefited from therapy or support. Policy and infrastructure reform. Mandate mental health screenings in routine geriatric care. Fund community-based programs that integrate mental health with social connection, mobility, and caregiving. Challenge ageist policies that that exclude older adults from mental health research or services. Okay, give me 1 second, guys. Gotta change paper. Would you like to co-design a myth-busting toolkit or implementation guide for rural aging communities or caregiving networks? I can help you build it out with participatory frameworks, sample modules, and evaluation matrix. There are quite a few persistent myths about senior mental health that can lead to underdiagnosed stigma and missed opportunities for support. Here's a breakdown of the most common misconceptions along with certifications that might be useful for your myth busting work. Common misconceptions about senior mental health. Depression is a normal part of aging. Aging does not inherently cause depression. While older adults may face grief or illness, depression is a treatable condition, not not inevitable one. Seniors don't experience anxiety. Anxiety is common in older adults, but often goes undiagnosed. Up to 27% report symptoms like panic attacks or intense fear. Dementia is inevitable. Memory lapses are common, but dementia is not a guarantee outcome of aging. Many seniors maintain strong cognitive function. Therapy doesn't work for older adults. Seniors benefit from therapy just as much as younger people. It's never too late to develop coping strategies for processing emotional challenges. Give me 1 second, guys. I gotta go get some lights on and I'll finish. Be right back with you. I have to turn lights on. I'll be right back. All right. Okay. Therapy doesn't, here's the myth, guys. Therapy doesn't work for older adults. Seniors benefit from therapy just as much as young people. It's never too late to develop coping strategies or process emotional challenges. Addiction only affects younger people. Substance use disorders are rising among older adults, often linked to chronic pain, isolation, or grief. Seniors grow out of mental health issues. Mental health conditions don't simply fade with age. Ongoing support and treatment is essential. Treatment is only for serious illnesses. Many seniors downplay symptoms, but early intervention can prevent uh, acceleration and improve quality of life. Older adults can't learn new things. Seniors are fully capable of learning, adapting, and thinking, thriving, whether it's tech, art, or new coping skills. They need less sleep. Sleep needs remain consistent across adulthood. Poor sleep can worsen mental health and increase dementia. If you're developing outreach materials or toolkits, I can help you design culturally responsive messaging or virtual myth busting guides or even interactive models for caregivers and community health workers. Want to co create one for rural aging populations or integrational programs? Next. Culture profoundly shapes how older adults perceive, express, and seek support for mental health, and understanding these notions is essential for designing equitable, responsive interventions. Here's a synthesis of key insights drawn from comparative studies and multicultural care frameworks. Cultural influences on senior mental health perceptions, benefits about mental illness. Western cultures often view mental health through a biomedical lens, emphasizing diagnosis and professional treatment. Eastern and indigenous cultures may interpret mental distress as spiritual imbalance, karma, or ancestral disruption, leading to preferences for holistic and traditional remedies like acupuncture, herbal medicine, or prayer. Stigma and silence. Many cultures, many cultures, mental health is stigmatized as weakness, shame, or moral failure, especially among older, expected to model resilience. This can lead to summations, expressing emotional distress through physical symptoms, fatigue, pain, which can be misdiagnosed or overlooked. Help seeking behaviors. Seniors may prefer informal support networks, family religious leaders, or traditional healers over mental health professionals. Collective collectivist cultures. Seeking therapy may be seen as disrupting family harmony or exposing private matters. Treatment preferences, culture, uh, consequence matters. Elders may reject pharmacological or Western psychotherapy in favor of community based spiritual or native approaches. Acceptance of care often depends on whether interventions align with cultural values around aging, autonomy, and healing. Systematic barrier, language mistrust in institutions, and lack of culturally uh, com- compliance providers can deter engagement. Health systems that ignore cultural context risk misdiagnosis, poor adherence, and danger in this disengagement. Would you like to co-create a cultural adaptive framework or toolkit that integrates these insights into outreach or screening? Okay, guys, so that is it for tonight. I will see everybody tomorrow for shows in the afternoon about 2. So until then, Gator Wellness, have a good night, folks.